Carrie. My name is Angie. Today I'll be performing four different assessments on you, and this will kind of give me an overall about your general health. First, I'll be starting off with blood pressure, and this is, I'll get two numbers out of it, systolic over diastolic. Systolic is the pressure in your arteries when your heart is contracting, and diastolic when the pressure in your arteries when your heart is relaxing. And with these two numbers, the average range is 120 over 80, and the procedure is just a quick, I put the cuff on your upper arm, and I pump it. It might get a little uncomfortable, and then from there I'll listen and get your readings. Do I have your permission to do this? Okay. I'm first going to need you to uncross your legs and sit up straight. Okay. I'm going to put the cuff on you. Just palpating your brachial artery. Okay, would you like to know your results?
Yes.
Okay, you got 118 over 80, so that was within healthy range, so I would suggest that you get it retested between the next 6 to 12 months. Okay, so the next health assessment I'll be doing on you is body composition. This tests for the percentage of body fat, and it will measure the fat underneath your skin. And this is done, the procedure that is done is I pinch in 3 different locations, and I'll be doing this twice just to get accurate readings. And I measure in certain areas, and then I pinch the fat. It will get uncomfortable, but it'll be really quick, and I'll try my best to make it as comfortable as possible. Do I have your permission to do this? Okay, so I'm going to need you to stand up, and I'm going to turn you around. We'll face that way. Okay. So first I'll be doing your tricep. So I'm going to lift this up a little bit. Okay. Can you bend your elbow for me? So doing here. Relax the arm. I'm going to do a quick pinch and then get the number, okay? Okay. And one more time. Okay. Do you want to know it in parts, or do you want to know at the end all your numbers?
You can let me know
Okay. Just grab this really quick.
She does have the bag.
Okay. Next, I will be doing your iliac crest pinch. So, be pinching really quick. Okay. One more time. And the last one will be your thigh. I'm going to need you to put all your weight onto your left side. And I'm going to pinch really quick. Oop, I'm going to measure that first. Can you bend your leg a little bit? Here. Okay. Ready? One more. Okay, so would you like to know your numbers now?
Yes, please.
Okay, so your tricep was 22, your iliac was 11, and your thigh was 40. Your thigh is a hard pinch though, so I feel like that wasn't the most accurate it could be. From this, you could get your percentage of body fat, and the norm for men is 12 to 18%, and the female is 20 to 25. So from these numbers, I would calculate your BMI, and I'll do that later, but then you'll either fall below, like low, normal, or above kind of the average, and from there you kind of have to take it in different directions. Low, you want to look at your diet and exercise, like are you overdoing your exercise and not eating enough? Average, you want to stay the same, like that's a good number to stay in. And if you're over, you would want to make an appointment with the doctor and try to talk with them about your diet and nutrition and your physical activity. So that's what I got from your body comp. Next I'll be doing your waist circumference. And this will measure the distribution of the body fat. And if you do have more body fat in your waist, you're prone to more chronic diseases. So this is something important to check, just because if your weight says you're okay and your body comp says you're okay, this will be the true kind of determiner if you're going to be prone to those types of diseases. So can you walk a little forward? Maybe on your right side. Put your hands on the smallest part of your waist. Okay, perfect. You don't have to. It depends if you're comfortable or not. I could do it over. It's not a problem. Breathe in. And I'll do it one more time. Okay. So, would you like to know your results for that? Yep. I got 30, and I believe this is, for males, it's below 40 inches, and with females, it is below 35. So you are below the norm, so that is great. You are in good shape, and then kind of the same things as before. With normal, you would want to stay the same, so keep doing what you're doing. If you're low, you would want to get that checked out, and if you're above, you would want to get that checked out as well. The last test I will be performing on you is the flexibility, and this will measure your overall kind of the flexibility with your hamstrings and your lower back. And this is important because most injuries kind of occur in that area with everyday life. So shoes are off and you'll be sitting down. And with this, you want to keep your knees as flat as you can, and you're going to be putting your hands together and your middle fingers will want to touch. So I'm going to put this on the marker of 26, and then you will be wanting to push as far as you can forward and hold it for 2 seconds. I will be saying it out loud, so if you can hold it for as long as I say it, that'd be perfect. And I will be doing this twice. Okay? Ready? 1, 2. Good. Okay? One more time. 1, 2. 1, 2. Hold. Okay. So you got the same ratings for the same time. Would you like to know your results?
Yeah.
Okay, you got 35. So that's great. You flexibility is important, and I believe you fall within normal range. So that is great. The assessment is done, and your overall health is great. So it's great working with you.
Thank you.